It's very interesting. We are living in very interesting times, and no one actually knows what is going to happen the next day. It's interesting as well as uncertain times. So when we when National Department of Health ordered the vaccines, AstraZeneca, in December, it was under a huge pressure from the public as well, and we were in the midst of a second wave. So looking at what was available in South Africa, we knew that we had three clinical trials, but at that stage, AstraZeneca was the one that the trial has been done, although the data has not been out yet. It only became available last week. Important to understand, it's not yet been peer-reviewed either. But the data showed that it's quite effective against the variant of the first wave. And therefore, AstraZeneca will still be very effective in other countries who does not have our variant with its unique mutations. And that's where the problem started. So the trial was done before our vaccine, before our virus mutated. And therefore, afterwards, they used a serum of people who had the virus to try to see how effective our antibodies would be in neutralizing the second wave variant. And unfortunately, it showed at this stage to be 22% effective against a mild to moderate disease. There's no studies done on severe disease or hospitalization. As well as the age group was, for an average of 31 years. And they also didn't include a cohort of people with comorbidities. Again, there's nothing wrong with the way the study was designed. It was designed for a certain purpose, so there was no reason for us to believe that there was maliciousness in designing this study. So it is unfortunately not currently what we are seeing and experiencing in South Africa. It doesn't give us all the data, so there's not enough data on that, and therefore, after last week, when the report was leaked to the press, it became known to all of us, what the results were. As I said, it's not been peer-reviewed yet. Simultaneously, Johnson & Johnson also did their trials in South Africa, and their trials has been done on on a broader spectrum of age. So they included the age group of 65 and above, also included people with high blood pressure and diabetes. And they looked at the severity, people with severe disease, as well as hospitalization and death. And there was a 57% reduction in the patients getting COVID-19, including with the second variant. That's the difference between, the Johnson & Johnson and AstraZeneca. And I think it's important just to understand the difference between the two studies that has been done. So even though Johnson & Johnson also has not been peer-reviewed yet, the data at this stage is, as I've said, much more conclusive than the AstraZeneca vaccine. And it would be then prudent to use the AstraZeneca vaccine, the Johnson & Johnson vaccine in South Africa, especially at the healthcare workers. So the question now is, what do we do with the AstraZeneca vaccines that's lying in the fridge, except for leaving the fridge door open? What you can do is, to start maybe with an open label study, which you might, you have to communicate this very well to the population out there and ask for volunteers, with informed consent, so that we can, and with above all age groups, including all age groups, can see whether you can get data on the current variant that we are seeing, whether it would protect, and then again, would it protect against severe disease. We cannot really send the vaccine back. I don't think the company would take it back. I know there was, it's been asked, and the information was that they're not keen to take it back. And so we are sitting with it. So also important to understand that a lot of Africa, or especially our neighboring countries, is also now getting or seeing the 501Y.V2 variant. And so for even to donate it to them would also be problematic, except if you go much higher up to the north of Africa, where this variant has not been yet seen, to maybe donate there, or to run as well an open label study there to see what is happening. So it is a dilemma. It's going to be a political dilemma as well. I can just see how people are going to show fingers, and then, as in any good story, everyone wants a scapegoat. I'm not sure who the scapegoat here will be, but we will see.
Verkeersboetes behels meer as 'n klein ongerief met minimale gevolge. Jy kan 'n kriminele rekord kry of probleme teekom as jy jou rybewys of motorlisensie hernie, en die metropolisie kan jou by padblokkades lastigval om die boetes te betaal. Fines for You vir minder moeite met verkeersboetes deur hul te monitor en vinnig, wetlik en effektief af te handel, sodat jy nie die ongewenste gevolge hoef te dra nie. Ons spesialiseer in groot vlote en streef daarna om jou geld te bespaar. Kontak ons gerus op 011 867 7331 of besoek ons webtuiste by www.finesforyou.co.za.